Hello people, today I'll be talking about the top 10 things every Nigerian should know about high blood pressure, which we all know as hypertension. And this video is for Nigerian adults, and especially Nigerians over the age of 35. And the reason for this is because hypertension arises when the blood pressure is rising consistently. It's rise today, it's rise tomorrow, over the years, or over the months sometimes. And it has accumulated for a long period of time. Then it becomes a disease in such a way that the blood pressure of that person will always be high, and that is when medical attention is really needed. So the number one thing that I'll be talking about is that the major cause of hypertension, which means the mechanism of the rise of hypertension, how hypertension really occur in the body. That's the first thing. And how does it occur is that it happens when the pressure of your blood is high. And how will the pressure of your blood be high? It is when the flow of blood, right? The flow of blood meets a high resistance in the blood vessels. The pipes that are conducting your blood are called blood vessels, right? If they are thin, there will be a large resistance to the flow of blood, right? Which means the blood will need extra force to flow through them. And for the blood to need extra force to flow through them, right? What is going to happen? High pressure, right? But when the size of the blood vessels are wide, or is big, there will be easy flow of blood through them, and the pressure of the blood will be normal or very low at times. But the point is that the pressure of the blood being high or low is not the problem, but it has to be high at the right time and below at the right time. There is low blood when the blood pressure is too low as well. It's also a problem for patients, for human beings as well. So that is that for that. That is how hypertension works, and that is how hypertension affects people, right? When the pressure of the blood is not normal, right? When the pressure of blood that the body need is not correct. Maybe when the body need blood pressure to be high, it is not high, and when it needs to be low, that's when it is high, right? So that is how hypertension works. That's the first thing you need to know. And the second thing I'll be talking about is that how many Nigerians have hypertension. I can tell you that from the research and from statistics and from personal experiences of my clients and the people who have come to me over the symptoms of hypertension, right? And some people who have gone to the hospital to have gotten confirmed that they have hypertension. They've been trying to manage it, and it's got severe, and they come to me to seek for herbal medications to help their medical worsening, or even solely they seek for herbal medication to solve the problem primarily. I can tell you that mid-aged Nigerians, I'm talking about people over the age of 30, 50% of Nigerians, overall Nigerians, let's not even talk about people over the age of 30. Overall Nigerians, like 50% of Nigerians have it. And people over the age of 30, about 53 to 54% of them have hypertension. You are thinking why? Yes, because there is a lot of things in Nigeria. There's going to be rising people's that are going to be rising people's pressure. From even walking down the street and you hear a sound, you don't know whether that is gone or something. The country is not safe. Everything just happening randomly. You don't know what is going to happen in the next minute, and whenever anything happens, even if it is just a little thing, your blood pressure is going to rise. Your heart is going to fail. Your heart is beating faster, and all these things that are worrying people, mentally, and the condition of our society, right? It doesn't really give peace of mind, and that is one of the reasons that is giving rise to hypertension. And not only that, drinking and smoking, that's also weakening a lot of organs in the body as well, and weaken the system of the body in such a way that when all these factors that are causing hypertensions are happening, the body is not able to withstand the pressure that is being put on it. So a lot of Nigerians are having hypertension more than you can ever think of. So that is it. So the third thing that I want to tell you about hypertension today, it is, so how do you know you have high blood pressure. That's the third thing I'm going to be talking about. And there are three ways to know if you have high blood pressure, right? The first way is by signs and symptoms. But the fault about signs and symptoms is that it is not really accurate. But whenever you start seeing the signs and symptoms, you should be paying attention to that and make sure you consult your doctor on what to do. And the second way is to use a high blood pressure measuring instrument that is called sphygmomanometer. Right, the sphygmomanometer. I guess a lot of people would have seen this before. It is, it has a curve, it has a leather stuff like this. With a kind of stethoscope head, and a reading box. You know what I'm talking about. I think I'll put the name here. So you can use sphygmomanometer, you can use signs and symptoms, which is not really accurate, but the sphygmomanometer is accurate. And as well, you can use medical tests, right? But using medical tests is going to be determined by your doctor. So, and most times, using medical tests to determine if you have high blood pressure or not, it is usually using blood pressure is usually recommended, right? It's usually recommended to know the reason why you are having hypertension, right? So that the root cause of the high blood pressure will be traced. Maybe it is due to the food that you are, maybe it is due to the food that you are consuming, or whatever, so that they can know what exactly is wrong and they can fix it, and they can effectively handle and regulate the blood pressure for you, and give you proper treatment. So that's the third thing. So the signs and symptoms of the fourth thing are the signs and symptoms of hypertension. So the symptoms of hypertension include coughing, sweating. Sometimes coughing and sweating comes together, right? Blood in urine, irregular heartbeat, and vision problems. It comes with pounding in the chest, sometimes pounding in the chest, in the air, in the neck, right? Sometimes you feel the pounding towards your eyes sometimes as well. So those are the symptoms of hypertension.